If you're over 60 and wondering why your sex life isn't what it used to be, the answer might be sitting right in your medicine cabinet. I'm going to show you 7 common medications that could be sabotaging your sexual health and what you can do about it. Now, before we dive in, I need to say this. Never stop taking prescribed medication without talking to your doctor first. What we're discussing today is about having informed conversations with your healthcare team, not about making changes on your own. And if this information helps you, please hit that subscribe button. It really helps me reach more men who need this information. Here's something most doctors won't tell you up front. Nearly 25% of erectile dysfunction cases in men over 60 are directly linked to medications. That's 1 in 4 cases where the pills that are supposed to help your health are actually hurting your sex life. The problem is, when we're dealing with serious health conditions like high blood pressure, depression, or prostate issues, sexual side effects often get brushed aside. Your doctor might mention it quickly, or it might be buried in that tiny print on the medication insert that nobody reads. But here's the thing. Your sexual health matters. It's not vanity. It's not being selfish. It's a legitimate part of your overall well-being and quality of life. Let's start with the big one. Blood pressure medications. If you're taking beta blockers like metoprolol or propranolol, or diuretics like hydrochlorothiazide, listen up. These medications work by reducing blood flow and pressure throughout your body, including to your penis. Beta blockers can reduce blood flow by up to 30%, which directly impacts your ability to get and maintain an erection. Diuretics, also called water pills, can lower your body's zinc levels and reduce testosterone production. Lower testosterone equals lower libido. What you can do, ask your doctor about ACE inhibitors or ARBs instead. These tend to have fewer sexual side effects. Some studies even suggest they might improve erectile function. Medications like lisinopril or losartan might be better options for you. Number 2, antidepressants, particularly SSRIs like Prozac, Zoloft, and Paxil. These are some of the worst offenders when it comes to sexual side effects. SSRIs can cause 3 major problems. They can kill your sex drive, make it difficult to get aroused, and make it nearly impossible to reach orgasm. Some men report feeling completely numb sexually. The cruel irony, depression itself can cause sexual problems, and then the medication to treat it makes those problems worse. What you can do, talk to your doctor about switching to bupropion, also known as Wellbutrin. It's actually been shown to improve sexual function in some cases. There's also mirtazapine, which tends to have fewer sexual side effects. Your doctor might also consider adding a small dose of bupropion to your current antidepressant. Third on our list, prostate medications. If you're taking finasteride for enlarged prostate or even for hair loss, this one's important. Finasteride blocks the hormone that causes prostate enlargement, but it also significantly reduces your testosterone levels. Some men experience what's called post-finasteride syndrome, where sexual side effects continue even after stopping the medication. Dutasteride, another common prostate medication, works similarly and can be even more potent in reducing sexual function. What you can do, ask your doctor about alpha blockers like tamsulosin instead. These help with urination problems without affecting your hormones. For some men, a combination of saw palmetto supplements and lifestyle changes might be worth discussing with your doctor. Number 4 might surprise you, antihistamines. I'm talking about medications like Benadryl, but also some prescription allergy medications. These work by blocking histamine, but histamine actually plays a role in sexual arousal and orgasm. Blocking it can reduce your sexual response and make climax more difficult. What you can do? Try newer antihistamines like Claritin or Zyrtec, which don't cross into the brain as much and cause fewer sexual side effects. For sleep issues instead of Benadryl, consider talking to your doctor about melatonin or other sleep aids. Fifth, proton pump inhibitors for acid reflux. Medications like omeprazole, lansoprazole, and esomeprazole. Long-term use of these medications can reduce your body's ability to absorb zinc and magnesium, both crucial for testosterone production and sexual function. What you can do, work with your doctor to find the lowest effective dose or explore H2 blockers like famotidine, which may have fewer long-term effects. Lifestyle changes like elevating your head when sleeping and avoiding trigger foods might help reduce your need for these medications. Number 6. Muscle relaxants and some pain medications. Drugs like cyclobenzaprine or baclofen can significantly impact your sexual function. These medications affect your central nervous system, which controls sexual response. They can reduce both physical arousal and your brain's ability to respond to sexual stimuli. What you can do, ask about topical treatments for muscle pain, physical therapy, or targeted exercises that might reduce your need for these medications. Sometimes taking the medication only when absolutely necessary rather than daily can help. And number 7, anticonvulsants used for nerve pain. Medications like gabapentin and pregabalin are increasingly prescribed for conditions like diabetic neuropathy and chronic pain. These medications can reduce nerve sensitivity throughout your body, including the nerves involved in sexual response and pleasure. What you can do, if you're taking these for nerve pain, ask about other options like topical treatments, physical therapy, or different classes of pain medications. Sometimes adjusting the timing of when you take these medications can help minimize sexual side effects. So what do you do with this information? Here's your action plan. First, make a list of all your medications, prescription, over-the-counter, and supplements. Don't forget about things like sleep aids or allergy medications you might take occasionally. Second, schedule a specific appointment with your doctor to discuss this. Don't try to squeeze it into a regular checkup. Say something like, I'd like to schedule an appointment to discuss how my medications might be affecting my sexual health. Third, be direct. Say something like, I've been experiencing sexual side effects and I'd like to explore if any of my medications could be contributing to this. Fourth, ask specific questions. Are there alternative medications with fewer sexual side effects? Can we adjust dosages? Are there newer medications in the same class that might work better for me? Remember, your doctor wants you to have the best quality of life possible. If they seem dismissive about sexual health concerns, it might be time to find a doctor who takes these issues seriously. Here's the bottom line. You don't have to choose between your overall health and your sexual health. In most cases, there are alternatives that can manage your medical conditions without destroying your sex life. But you have to advocate for yourself. You have to bring this up with your doctor. They're not mind readers, and many assume that if you're not complaining about sexual side effects, everything must be fine. Your sexual health is part of your overall health. It affects your relationship, your self-confidence, and your quality of life. You deserve to feel like yourself at every age. If this video helped you, please give it a thumbs up and subscribe for more men's health content. And here's an important one. Share this with a friend who might need to hear it. A lot of men suffer in silence with these issues. In the comments below, let me know. Have you experienced sexual side effects from any of these medications? What worked for you when you talked to your doctor about it? Thanks for watching, and I'll see you in the next video.